So, next I would like to introduce Dr. Abha Saxena from the World Health Organization. Abba is somebody very close to my heart because for 4 years when I was at WHO and I was appointed head of the Research Ethics Committee, Abba was the secretariat, and we worked daily for 4 years trying to review some 300 research protocols a year.
Thank you. Thank you, Rosanna. Thank you, Trudy, for inviting me to this event. I'm really pleased to be here. I was asked to discuss why, and it's going to be slightly different from all the talks you've heard because it's coming the WHO perspective. So I was asked to discuss why research in low and middle income countries is difficult and why we have so few research leaders from the South. And finally, what WHO is doing to address this issue and how we can encourage more and better research. And it's a huge question, so I'm not going to pretend that I'm going to have all the answers, just a few thoughts. And I think one of the main factors that hinders health research in many countries is lack of access. It's lack of access to available and existing knowledge, lack of access to know-how, lack of access to tools, and lack of access to peer support. And some of these things we've already heard by previous speakers. One could argue that in economically disadvantaged populations, one should not waste money in research, but just go ahead with the business of healthcare provision, using results from existing research obtained from other countries. However, in order to utilize limited resources more wisely, it is imperative that all countries invest in the right and appropriate research to find the right and most appropriate solutions for their populations and their people. This research needs neither to be high-tech nor to require a lot of resources. Often it needs to be carried out in the context of day-to-day practice and in the field. And that's something Trudy mentioned in her talk also as well. Even though it need not be high-tech, it need not all be clinical trials, it needs to be health systems-oriented and health services-oriented. But it needs to be rigorous, and it needs to be sophisticated. And it needs to respond to the questions that are asked. It needs to be respectful and mindful of the concerns of the people at all levels. And this means that all people at all levels of the health system need to understand research, because we're not talking of professors and deans and university researchers who are important in this whole game, but the sort of research the WHO would like to support and is supporting in a huge way is not so much done in universities. Also that even though research may be conceived in laboratories or in universities, at the end of the day, the people who carry out the research studies or the people who collect data also need to understand the issues and need to be trained. So we're talking of research sort of percolating down to all levels. So everyone needs to understand the concepts of health research, why they do what they do, and why is it done in a particular way. They need to understand the fine line between clinical practice and research and need to have the right tools to help them. They also need the right environment where they can discuss with colleagues, both those who are around them but also those who are in other universities away from them, so that they're not working in silos, as someone mentioned, and get peer opinions on their studies. And this is where lack of access is the biggest challenge. And I'm really pleased that Trudy's group has developed this brand new tool, which is very elegant, to support researchers around the world. It will be a useful addition to all the other resources that already exist, but it cannot be on its own be enough for everything. It has to be taken in context. Coming to the question of what WHO is doing to encourage more and better research in these countries, can I have the slide, please? I'd like to share with you the current program of work for WHO, in which we have defined 6 leadership priorities that include universal, in the circle that you see, we have the universal health coverage, the non-communicable diseases, social, economic, and environmental determinants of health, increasing access to medicines, the international health regulations, and of course the unfinished agenda for the health-related Millennium Development Goal. So these are our 6 leadership priorities, and they cover sort of more or less most of the health systems-related issues. And these priorities are addressed through 6 core functions, which are in the squares outside the circle, which is providing leadership on matters critical to health, shaping the research agenda, articulating ethical and evidence-based policy options, providing technical support, building sustainable capacity, monitoring the health situation, assessing health trends, and then setting norms and standards. So in the area of research then, these priorities we address. So research is sort of encompassing all, it's all encompassing in all the 6 priorities. And we not only support health research to generate the evidence that is required, but also support the use of research that already exists and ensure the development of evidence-based policies. We also support development of norms and standards through the guidelines, and through the Guidelines Review Committee, the development of evidence to develop the guidelines. When we look at the area of health research and within the framework of WHO, what is really significant is that in the recent past, we have recently established a department called Knowledge, Ethics, and Research, which brings together 2 or 3 different departments which existed separately earlier. And this particular department includes a team which is focused on research, and then another team which is focused on ethics, including research ethics. So there's a real harmony between the 2 teams because we're in the same department. It's just easier to collaborate and easier to work together. And some of the key research-related areas, activities that we are involved in, can I have the next slide, please, include all these activities that are part of the work that WHO is doing to promote research in low and middle income countries. By definition, we work much more in low and middle income countries, having support from the high income countries to move the agenda forward. And the various research-related activities that we are involved in includes, for example, the Health Research Observatory, which is a brand new program which is going to be developed soon. We have a program called the EVIPNet, which brings research to policy, which has been going on for the last several years, I think 8 to 10 years. The ICTRP, which is the International Clinical Trials Registry platform, which helps to bring all research clinical trials that are conducted anywhere in the world on a single platform, so you have information about all the clinical trials of the world. We developed tools for training, and one of the tools that we developed for WHO staff actually was very happily taken up by Trudy, and we have now a global tool for research ethics, which I'm told is quite successful. We are in the business of setting norms and standards. So we have developed norms and standards for priority setting in research, for research registries, and for research ethics systems. And I want to talk a little bit about the research ethics systems because that's my area of work. So we're developing norms and standards for research ethics, not only for ethics committees, but ethics systems, which includes ethics committees, researchers, the population, the communities, etc. And we're trying to see how we can get countries to uptake these standards and to develop indicators to see how well they're doing. And then, of course, we support platforms and networks. That's our core key area that we work in. And I feel that while we are working on all these areas of networking, providing tools and sort of making it easier for people to access all these great tools that exist, I think for me, one of the biggest challenge is, and I think that one of the best way of improving health research is to focus on standards. Not only ethical standards, which is my area of work, but also scientific standards, because I think that's sort of forgotten in this whole game because people just tend to focus on, they assume that the scientific standards exist. And so I think it includes, for example, establishment of national structures that can take responsibility for these standards. It cannot come from, WHO asks you to do this, therefore you should do this, or the London schools asking you to do this, therefore embrace these standards. They need to come from within the country. So the countries need to establish these national mechanisms to say these are our standards and they comply with international recognition, etc. So, and these countries should take responsibility for training the researchers. They should take responsibility for raising public awareness and for involving the public in some of these debates. And we, at WHO, we support many of these functions through our various programs. We know we can do more, but I think we need to do it together because alone, of course, one organization cannot do it. So I'm hoping that we can sort of generate here some of that push to do some of this work. So I'm going to stop here because I think the panel discussion is more important.